Welcome to the Business of Government Hour, a conversation about management with a government executive who is changing the way government does business. The Business of Government Hour is produced by the IBM Center for the Business of Government, which was created in 1998 to encourage discussion and research into new approaches to improving government effectiveness. You can find out more about the center by visiting us on the web at businessofgovernment.org. And now, the Business of Government Hour.
Welcome to the Business of Government Hour. I'm Michael Keegan, your host and managing editor of the Business of Government magazine. In an era when information and data have become major strategic assets, the U.S. Department of Health and Human Services, HHS, sits atop a vast array of both data and information that, if leveraged properly and applied innovatively, could transform health and healthcare delivery within this country. With advances in technology and the development of various collaborative platforms, we are witnessing a prime opportunity to make a vision of the future a reality of today. It is about encouraging innovators to use health data to develop applications that raise the awareness of health and health system performance and spark community action to improve health. And the HHS Office of Chief Technologist is pursuing such an effort. What is the U.S. Department of Health and Human Services Technology Innovation Strategy? What is HHS doing to make data more accessible? How is HHS using technologies and innovations to meet its mission? And what is HHS doing to be more transparent, improve accountability, and increase opportunities for public engagement? We will explore these questions and so much more with our very special guest, Brian Sivak, Chief Technology Officer at the U.S. Department of Health and Human Services. Last year, I've had a number of CTOs on. For our purposes, what's the difference between a Chief Technologist or a Chief Technology Officer and a Chief Information Officer?
Good question. And I think it actually probably, the answer to that probably depends on who you're talking to and what organization you're talking about. In HHS, our CIO is a guy named Frank Bateman, wonderful guy who, is very forward-thinking, has a lot of great ideas about how technology can be leveraged to better execute the mission of the department. His focus is really more, I would say, on the sort of internal, pipes and plumbing and the things that make the system work, right? So this is everything from email to HR IT systems to financial systems to things like that. And so what Frank really focuses on in his role as CIO is, how can we make the processes more efficient by using technology and by leveraging IT to do some of these things. One of the interesting things about my job in particular is that I actually have two titles. One title is Chief Technology Officer. The other title is Entrepreneur in Residence. And in many ways, I actually think the EIR side of my title is a little more descriptive of what I actually do. One thing I've learned over time, and I say this as a technologist and as a big geek, right, and somebody who loves technology and thinks that, usually jumps to a technology solution is the first one because it's just how my brain works. But one of the things I've learned over time is that technology is rarely a solution to a problem. Technology can be an enabler, it can be a catalyst, it can be an accelerant, but it often needs to be sort of layered on top of some more fundamental change, which would be usually culture change or process change. And so that's where I think the EIR side of my job comes in. And a lot of what we're focusing on right now is how to actually affect cultural change within the department so that we can put technology on top of it and actually make things better.